Do you or someone you know suffer from seizures? It is a scary medical condition and one you may not know how to handle if it happens to you or someone you love. We're getting some answers today from local North Shore neurologist Dr. Chad Domingue on exactly what this is. Thank you so much for joining us.
Yeah, good afternoon. Coming from my hospital today, so excited to see you guys.
I know you're in between surgery. Appreciate
Yes,
this. Let me start by asking
absolutely.
you, what is the medical explanation for a seizure and what exactly causes this?
Yeah, so think about a electrical thunderstorm in your brain, right? So a seizure is all your neurons firing at a very fast rate. Most laymen think about the general tonic-clonic type seizure where there's a lot of movement, but depending on where the seizure occurs, you can have a frontal lobe seizure that gives you like dementia. You can also have seizures that make you kind of out of it or talk. And so it's not always a movement type thing. So when we're looking at seizures, we're trying to figure out what is causing this excitation of the brain. Is it a infection? Is it a drug? Is it a primary problem with the brain? So we're trying to figure out what's causing that computer to fire at an abnormal rate.
So what exactly are the symptoms when this is happening, and what should you do if you witness this happening to your loved one?
Yeah, you got to pay attention to their consciousness. So as in children, you get these absence seizures, right? Just a stare. Then obviously we mentioned the tonic-clonic, but you want to look at a pattern. Are there times when a loved one or family member just seems out of it? There's space here. They have like a little lip twitch, or it can be very, very, very subtle. So you really have to lean on the family. You have to pay attention to what's going on because you need to find a change in a behavior that's not typical for this person in a normal state.
So in that moment when that is happening, do you clear, objects that could be in the way of the person if they're having a seizures? Do you try to hold them down? What do you do?
Yeah, the first thing is, and I see this in the medical world all the time, a seizure is not like a heart attack. It's not an emergency. You have to seize for over an hour before it causes irreparable damage to the brain. So the first thing is remain calm. You see someone kind of moving at a rapid rate, you want to lie them on their side. You want to make sure they're not aspirating. You want to make sure their airway's protected. But more than anything, you just want to make sure they're not going to hurt themselves with those movements and allow the seizure to play its course and then kind of tend to the patient after that.
Could they also foam at the mouth, and why would that happen?
Yeah, so as they contract all these muscles, they'll contract all their mastication muscles, and that contraction will push down on the salivary glands and cause that foaming. And again, this is why it's important to put a patient on their side, because if they're on their back, that saliva can go in their lungs and their airways, and that can obviously lead to a much severe problem with aspiration and pneumonia and so forth.
Tell me about the test to determine what is going on, and is it possible the test can never tell you why someone is having a seizure all of a sudden, or it pops up every now and then?
Yeah, so this is a good point. A seizure means you had a single event. Epilepsy means you have recurrent seizures. So a single event could be anything: low sugar, stress, lack of sleep, a medication. Whereas epilepsy means you have some kind of primary neurologic problem that's going to make you have seizures over and over again. So we look at MRIs, we do blood work, we do brainwave tests, EEGs. So you're just kind of going through the differential diagnosis and finding the right answer.
So let's talk about treatments. What is there out there for a neurologist like yourself to treat this, whether it's for the person who has it pop up all of a sudden or someone who has it regularly for epilepsy?
Yeah, so first thing is look for a cause, right? So like we talked about, check blood sugar, electrolytes, that kind of thing. Hopefully it's something that we can just reverse. I always say in neurology, you get one free seizure, meaning if you have one seizure, you don't want to put people on medications. But if they have recurrent seizures, that's where it gets very tricky. There's a host of medications that you have to see a high-level neurologist to figure out which medication works for what seizure type. There's surgeries where we can cut part of the brain out to remove that part of the brain that's causing seizures. There's an electrical device called a vagal nerve stimulator that can treat seizures. Ketogenic diet, which I think a lot of people are familiar with for weight loss, actually helps treat seizures. We talked about CBD oil, last week, again, for seizures. So it's very difficult. It's a high expertise of a medical treatment plan. So you really need to work with a neurologist that has a lot of experience treating these type of disease processes.
Bottom line, it's not normal, so get it checked out no matter what happens.
Yeah, it's not normal. You want to look for again, changes in trends, and it's not always that movement. So you really want to pay attention to someone to see if there's a change in behavior and those type of things as well.
Well, you are a neurologist, the expert in this, and I thank you so much for taking the time out of surgery today to highlight something that can be pretty scary. Appreciate it.
Absolutely. Anytime, Liz. Have a good rest of your Wednesday.
Thank you.